Good afternoon. Graduates, please be seated. Welcome to the inaugural commencement ceremony of the Julia Jones Matthews School of Population and Public Health. I'm Jerry Carino, inaugural Dean of the Matthews School. Graduates, if you're not seated already, sit down. It's going to be a while. It's my honor to welcome our graduates, their families and friends, our community, and the community of scholars who have come to share in this celebration. We celebrate commencement at the end of an academic journey. Today's graduates are the ones who will promote healthy lifestyles, break or epidemic, or believe me, it's coming, and the ones who will save our neighborhoods and communities of West Texas, our great state, our country, and our world trillions of dollars and countless years of life lost to death, disability, and disruption. Today's graduates are the unsung heroes of the bad things that didn't happen. Population and public health are all about community, collective action, and building one good idea or innovation atop another and another and another. We at the Julia Jones Matthews School of Population and Public Health have been very much the beneficiary of such a community effort. We owe our very existence to it. Though it may seem that launching this newest school at the Texas Tech University Health Sciences Center is a smart and timely response to the worldwide pandemic that has so disrupted our lives and the world economy, in fact, the backstory is so much more prescient. The clear and focused vision for a world-class institution to offer a best-in-class public health education to West Texas and beyond predated the COVID-19 pandemic by almost a decade. Way back before 2012, while many of us were discovering Instagram and dancing Gangnam Style and eating quinoa, visionaries and movers and shakers like Mr. Joed Cannon, Chancellor Ted Mitchell, whom you heard from a little earlier, he was just a president back then, Dr. Billy Phillips, here on stage, and Dr. Teresa Bird, who was our first department chair of public health, and of course the Julia Jones Matthews family had that prescience, and they foresaw an essential need. The need to prevent the bad things and the really bad things. The need to promote health and wellness, not just to treat sickness after the fact. The need to understand deeply those behaviors and structures and environments and situations that yield good health or contribute to poor health. Ladies and gentlemen, through the visions and efforts of a few, through the generosity of a wonderful family and this very strong community of Abilene, and through the hard work of these graduates who will walk the stage this afternoon, West Texas and our world are a far better, healthier, and more productive place. To the class of 2023 and the December graduates and the summer graduates of 2022, some of whom are joining us today, I offer my sincere congratulations and my thanks for all of you, for all you have done and for all you will do in your careers. I welcome to the podium Dr. Lori Rice Spearman, President of the Texas Tech University Health Sciences Center, who will deliver her President's Address. Dr. Rice Spearman.
Good afternoon, and thank you, Dean Carino, for those comments. On May the 24th, 2022, I shared an announcement with our university family for the official notice of the sixth school at the Texas Tech University Health Sciences Center, the Julia Jones Matthews School of Population and Public Health, located in Abilene, Texas. That historic milestone would not have been possible without our excellent leadership across the university, our alumni, who were the pioneers of our public health program, and now who are transforming public health in communities across the state, the Abilene community who has generously supported our vision for this school, and of course, each and every one of you. Upon approval in 2013 by the Texas Higher Education Coordinating Board, the Masters of Public Health degree program enrolled its first class of 23 students in the fall of 2014. The program became accredited by the Council on Education for Public Health in 2018. Today, the school enrolls more than 5 times its initial class size. The recent pandemic has increased awareness of the importance of a strong public health infrastructure and the need for well-trained, community-based public health practitioners. Our alumni from the Julia Jones Matthews School of Population and Public Health address these needs, especially in the rural and underserved areas of Texas where the disparity is the greatest. For this inaugural graduating class, I want to provide a personal congratulations to you on this commemorative day. We are very proud of the Texas Tech University Health Sciences Center and the outstanding graduates that will embark on the next phase of their career to help transform healthcare for families and friends throughout the state and nation. We like to say that the Julia Jones Matthews School of Population and Public Health is going to help us put health back in healthcare in our families and our communities. Our graduates represent the very best in each of their fields and bring a sense of pride and prestige to our entire university. As I wrap up my comments for today, I want to share a few things with you. I want to encourage you to always be yourself. You will be a worthy ambassador of your profession, our institution, and among your peers. Oftentimes, you will be educating those about what public health is and how important it is to what we do each and every day in our communities and delivering health care. I also encourage you to be daring. We have trained you to innovate. We have trained you to collaborate. You are going to transform healthcare for Texas and beyond. And finally, don't forget us, because we are dependent on you. You are forever a part of the Red Raider family, and we will always be here to support you. With that, I offer my best wishes.
That was not part of the script. This is very nice. Thank you, Dr. Rice Spearman, Provost D'Agostino. About a year ago today, the Julia Jones Matthews School of Population graduation class. So many brought us to this day and to this celebration. Thank you to our faculty, all of them sitting over on the far end of the stage, and to our staff who are sitting amongst you. All of them are here, some down here, some in the back. Our faculty and staff have demonstrated tremendous help. He leads with grace, wisdom, and expertise. Let's give our leadership a round of applause. Thank you also to the families and friends of our graduates for supporting them to hear this calling. You know what you did, and we do too. You sacrificed, you waited, you anticipated, you dreamed and aspired and maybe even cried a few times. We see you, and we appreciate you. Graduates, let's give our family and friends, our faculty, and our leadership a round of applause. I welcome to the podium Dr. Billy Phillips, Executive Vice President and Director of the F. Murray Hall Institute for Rural Health, to the podium.
It's my honor today to present the special recognition for medicine and the Julia Jones Matthews School of Population. This year's award recipient for the United States Public Health Service leadership and hard work were evident in her passion and dedication to public health within the medical profession, and her accomplishments clearly support health promotion and disease prevention. The commitment of medical professionals to public health is important to improving awareness and understanding of public health, disease prevention, and health promotion among the general population. Chelsea, I encourage you to continue your passion with dedication to public health, to be a leader in the profession, and most importantly, to lead with selflessness.
Thank y'all so much. Thank y'all so much for this award. She gave me a chance with a phone interview when I decided I wanted to pursue a master's in public health during medical school I'm eternally grateful for that opportunity that has allowed me to learn and achieve so much in just my short time here, so thank you for that. And thank you to Dr. Dennis, who has been a great professor and mentor to me, especially for my Physicians, Patients, and Populations project. And lastly, but not least, thank you for all the love and limitless support from my husband, my dad, and my mother. And I just wanted to leave you all with as a soon-to-be physician, I am honored to have a master's in public health. I can now wholeheartedly
Church podium. Mackenzie graduates today as a promising public health practitioner who is globally minded and passionate about improving the health of rural populations. She is a staunch advocate for measures and policies that reduce the rise. Throughout her time in the MPH program, she has served the Texas Department of State Health Services and has also received the Presidential Scholarship from the Department of Public Health that seeks to recruit students who provides. I don't have the award.
My passion in local classes and thank me in my public health journey, and one that I hope will inspire you all as well. We need to stop.
The Texas symbol on it, and I think you can tell from her past.
Everybody, it's very hard for us to see you, but I can tell you're all smiling, you're happy. I can look this to lend some reflections on what's kind of happened with public health and how we got to this point. Before we do that, though, we have to call out some people who really made this happen. Joe Ed Cannon, I see, is in the audience, and I wanted to thank you. He is representing the Matthews family today. I know Cade, Chris, and Watt couldn't make it, but we really just can't tell you how heartfelt and wonderful the generosity of this community and everybody that we have met has been to creating this school. Billy Phillips, I did want to call you out. In a time when we needed to begin setting the foundation for what is to come, you've been a man of vision, grace, and honor, and I thank you for that. Dr. Rice Spearman, thank you for being such a wonderful leader. I will tell you I'm going to do two tangents today, and the first one is this one. On my third day, and I just want to orient everybody, I was still being oriented to the school. Dr. Rice Spearman pulled me in and said, we need to open a school of population and public health. So she knows I don't walk away from challenges, and I don't see them as obstacles, I see them as opportunities. And I just wanted to say this has always been a dream of mine to do that, so thank you very much. And to Dr. Mitchell, I know you heard from him earlier, his vision many, many moons ago. And Joe Ed, thank you for sharing the story with me earlier today. Without that vision, we wouldn't be here. So thank you all for this. Before we move on, our faculty, would you please stand up for me? This is always an incredibly important moment for me, and the reason that is because each of you, every graduate, has a piece of their DNA now. Every time you walk into a problem, hear something that doesn't make sense, attack a problem, doesn't matter what it is, a piece of them are going to come through, and I wanted to personally thank you for that. Thank you very much. So some of those reflections. So as I mentioned, this was a dream of mine, integrating public health and many of you know this, I have an MPH. I never went on to do the Doctor of Public Health because I was always in the weeds with public health. I was always on the ground implementing programs or doing things that had to do with the people I was treating as a physician. And as I began to think about that integration, suddenly a word came up during my lifetime that changed how public health is viewed and how it's used, and that was population health. And we're not going to go into all of that history, but really what it is a marriage of the amazing things that happen in the public health world and the application that has to happen for all other healthcare providers. I want you to keep that in mind as I finish up, as I continue to talk and finish up, because we're going to come back to that theme, because that will be your charge in the future, to take what you've learned here and translate that into something that can help people in their everyday lives succeed and be healthy. The other thing I wanted to talk about from that dream was the amount of work I didn't realize it was going to be. Everybody on this stage, many people that couldn't be here today, teams that were brand new and just built over at the Health Sciences Center, all came together in such an amazing way. The GSBS, where all of this was born out of, everybody came together. They came together so that we could create something that was so needed for our communities, and something that could help integrate all of the mission, all of the vision and mission of the university, which is to innovate and collaborate and to care for the communities that we serve. So yesterday was the very first graduation since 2020 that I've been part of that did not mention the pandemic. It was the very first celebration that didn't bring up COVID-19 or the pandemic. And so by me talking about this, obviously, I just broke that trend. But there's a reason. There's a reason why I'm bringing it up, because today we have to mention it. And we have to mention it because it is what threw all the light on public health in all its glory, because it was so we do need, anybody on the stage can do this too. First word, power. Second word, cadence. Third word, drops. I'm giving you all the hard ones, by the way. Fourth word, draft. Almost. Really good draft this year. Go KC. Sorry about that. Had to say it. Sprinting. All right, now competitor. And that person that's out in front, all the people behind them. Pace. They're watching for problems ahead. And when the teams, and all of those teams who are competing for the same resources, medicine, nursing, doesn't matter what discipline. It's time for public health to pull the teams, to lead that path to the health of our communities. And that's what I want to leave you with, is the challenge of setting up a baseline